Hi, I'm Tim with St. Louis Community Credit Union. If you don't know me, I'm the Director of Financial Wellness here, and we are doing a partner spotlight today with some healthcare experts, and I will let them take it over.
Hi everyone, I'm Jason Bielhauser, the owner of St. Louis Medicare Benefits. We do anything health insurance wise from Medicare to Affordable Care Act plans. We really specialize in lower income communities that are having issues with Medicaid or really any health insurance policy. If you're not sure what's going on, we're just here to help. This is
And my name's Sam. I am Jason's executive assistant at St. Louis Medicare Benefits.
Well, thanks again for you all being here, and thanks again for partnering with our membership. So speaking of membership, what can you all do for our members?
Yeah, so since we specialize in health insurance, if there's ever anything you have questions about, even on your current plans, whether we become your broker or not, we can actually walk you through what your plan entails. You'd be surprised on how many people don't know what like a health deductible is. So questions that we can answer and just make sure you understand how to use your policies. But even with that said, if you have family members that maybe don't have health insurance, there's so many options available off the marketplace, Medicaid, that we can help you get set up with so that no one's undercovered and that they're not, at financial risk of something happening, like they go to the hospital, they don't have anywhere to cover it. In addition to that, we do Medicare, like we said. These plans, whether they're Medicare or Affordable Care Act, they change every year. So if you're not reviewing them, or actually around this time, all the way till December, you could be left, with your doctor not being in network, not being able to see your providers, or maybe you have a handful of prescriptions that all of a sudden the formulary changes, and all of a sudden you're paying $300 to $500 a month extra, and you could have had it solved if we just took a review at it and made sure you're on the right plan for you. So quite a bit of stuff.
Wow, no, and that's just crazy. Every year it just changes, even though it's like you have certain things and needs for your body and family. It's like, oh no, we're not going to stick to that at all. It's just every year we'll switch it up. So I'm glad you all kind of went over that. So what would your ideal referral be?
Yeah, again, really anyone that's having issues with health insurance, they don't have health insurance, maybe they think they're paying too much on their health insurance, and anyone that is maybe disconnected from their broker or doesn't have someone in their corner advocating for their benefits and making sure they are on the right plan. There really is no bad referral because, like I said, we do actually group insurance as well, but again, all the individual stuff and Medicare stuff, so really anyone could be a potential referral to us because we really can help about anyone at this point. Yeah.
So how do we bring your services to our members? How do they get in touch with you?
Yeah, so we actually have a Dropbox in the branches that we're working with currently, and we're expanding. We know we have several locations, so we're kind of going that slowly. We wanted to take it one branch at a time to make sure we had it running and everyone kind of understood the program. But there's a Dropbox with a permission to contact form, so if they need help with health insurance, they just fill that out, make sure they put which of the tellers or bank managers or whatever employee referred them, because we are doing a referral bonus. So any appointment that we run from one of your referrals, you actually get $50 back to whoever referred them. So make sure they're writing that down so we can get that back to you. And again, this is in most cases for people we run appointments with. What was her name that we had? The son get health insurance?
Ashley.
So Ashley, her son had no health insurance. He's hadn't reported himself. I won't go into too much detail. Basically got him a free plan, so he's covered. So there's a lot of ways that we can help. And then there was another, and we don't need to name everyone's name, but another mom of an employee that she was just on original Medicare. And when you're just on original Medicare, 20% of all bills are your responsibility. So we got her actually much better coverage where she's going to a primary doctor paying $0 and a $20 copay at specialist, where if anyone knows anything about specialists, they can charge $1,000 to $10,000 an appointment. If you're paying 20% of that, that can really hurt you.
Yeah.
So definitely, I think making waves with even the employees. But if anyone needs help, that's kind of the stuff we take care of and make sure you're saving money while getting extra benefits.
No, and that actually leads into my next question. So can I refer family and friends or yourselves again? So this is open up to our membership, but also the community that we serve in, and we're part of that community. So if you have any questions yourself, you can go directly to Sam or myself, and I can get you in contact again. So this is for membership, family, friends, and yourself. So we'll keep it discreet, and all the information, it would just be, between you and Sam to get everything, the application set up and all that. So that's good to know that anyone can basically use these services, or
Yes.
at least take the meeting and learn more about
Yeah.
it. That seems like
And-
the biggest thing.
And a big point for everyone here, we are not high pressure sales at all. We are strictly consultants, and most people that become clients of ours is because we are able to save them money or do something that was benefiting them. So just wanted to throw that out there. So you never have to feel like you're sending someone to us and they're going to get mad at you and come back. No, we're strictly consulting them that, hey, there's better options out there, and if there's not, we'll be the first ones to tell them as well.
Well, and then also a few other things. I tell the employees all the time, I'm only going to call these referrals one time. I will leave them a voicemail, but I am not going to hound anyone to try to get them on the phone. That is not part of the referral program, is forcing them to take an appointment. We want to willingly give them the information and the education and return a call maybe. But whenever they set up an appointment with us, that's when that referral bonus is paid out. They don't have to sign anything. They don't have to get a plan. As long as they just take that phone meeting with Jason, that's when that referral bonus is paid out. It's very easy.
And again, the reason we're able to pay it out on appointments is because we're so confident that in most cases, I would say 80-90%, we're able to actually help people, because most people are kind of disconnected from what they have and don't know there's better options out there. So
Awesome. No, that's great to hear, and that's what we want to give to our members, just the access to these services and programs and the knowledge so they can make the best decision for themselves.
Exactly.
So, speaking of all these services, how much do these cost?
our services are completely free. Yeah, we don't charge them anything. And again, like we said, most of the time it's actually saving them money as well. We get paid directly from the carriers from helping them with their plans. And since it's all regulated by the Center for Medicare and Medicaid Service, CMS, it's all flat rate no matter what carrier that they're choosing basically for their plan. So there's no steering or anything like that. So it's strictly consultative.
Do you only sell Medicare plans?
Nope. Medicare Affordable Care Act, which is under 65. If the under 65 stuff isn't a good fit, we have short-term options as well. Then also small and large group plans. We do dental, vision, and hearing, and then a bunch of ancillary plans like accidental, gap plans, hospital indemnity. So a bunch of stuff that may or may not be of use to you.
Well, I just want to thank you guys for showing up and kind of going over what you can do, how you can do it. And if anyone has any questions about their services, the referral program, you can come to me either through Teams or my email, and then I can get you in touch with Sam and the rest of the team. But also, we're going to be expanding to most of our branches, if not all of our branches here in the next quarter in the 2026. So be on the lookout for more of that, marketing type of, and also on the hub as well. So appreciate you guys for stopping by.
Awesome. Thanks for
Yeah, of
having us.
course.
Tim.
Thanks.
Thank you.